welcome everyone to the Health Insurance Education Series. This one is about Social Security benefits. This is hosted by Division of Specialized Care for Children, and we have some great partners from the Social Security Administration here with us tonight to present on this great topic. I just wanted to remind everyone, or if you're not aware, that this is part of a series of webinars. So this is our very first one for the 2024 season, but we'll have 2 additional webinars in April and May on different topics. So if you're interested in learning more about health insurance and different topics, we're going to cover some information on Medicaid denials in April. And then in May, we're going to talk about transitioning health benefits to adulthood. And I'll have a slide at the end that kind of explains how to register for those ones if you're not registered for that yet. You can get a copy of the slides on our website. So if you go to, I put it in the chat, but if you go to dscc.uic.edu, you can go to our family education webinar page. It's under the browse resources section. So if you click on that, you'll be able to, get a copy of the slides to follow along if you want to. We are recording the presentation, and the recording will be posted on the website in the coming days once we're able to prepare it. And we ask, just because it is being recorded, as much as possible, just don't share any personal information. So if you're asking a question, don't put personal information in that question, because we want to protect your privacy as much as we can. So I'm Brittany Provost. My name tag, for whatever reason, is not showing up. But I think I changed it in the chat. So I'm the Manager of Benefits Management and Research at DSCC. We're a unit that works with health insurance. We work with the DSCC care coordination teams to help solve insurance problems, and we do things like this to provide education on health insurance. We have 2 great presenters, I said before, from the Social Security Administration, Jack and Megan, who are going to give lots of the presentation tonight and give you all the good information about Social Security. So I'll hand the presentation over to them in just a moment. But I did want to just kind of, if anyone here has not been involved with the DSCC before and has no idea what we do, I just kind of wanted to give a little bit of information about what we do so that you could be informed. So our vision here and our mission. So I'm not going to go too in depth with DSCC's programs and things like that tonight, but our vision is that children and youth with special healthcare needs and their families will be at the center of a seamless support system that improves the quality of their lives. And our mission is that we partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources. And being able to provide training like this is a big part of that. We want you all to have the information directly so that you feel that you can, navigate the healthcare system as best you can on your own. Okay, I'm going to stop sharing, and Megan, I will turn it over to you or Jack to start the presentation. So thank you so much for being here.
Thank you, Brittany. Megan's going to share her slides here in a moment, and then she'll kick us off.
All right. Yes, thank you everyone for joining us. So today we're just going to go through a lot of information regarding our disability programs primarily, and touch a little bit on other types of benefits that children can receive as well for us. So focusing on children, the main benefit that we have payable based on a disability is Supplemental Security Income, or SSI for short. This is a federal program that provides monthly benefits for people with limited income and resources. So you do not need any work history at all for our SSI program, but you do have to meet the income and resource requirements. This program is for age 65 or older, with or without a disabling condition. We don't do a medical decision after that age, as well as those of any age, including children who are blind or have disabilities and have that limited income and resources. Now, SSI for children, I don't love this definition of SSI for children because it's kind of a little more complicated than it seems. A child for SSI is anyone under 18 or under 22 and regularly attending school. However, at age 18, we do consider them an adult when making our medical determinations. We go by our adult definition of a disability. And we also stop looking at parents' income and resources at age 18, whether or not they are regularly attending school. But if they are still attending school, we need to know that when making medical decisions so we can review the type of school program they have. And we also have additional income exclusions whether it's the child themselves who's applying for SSI that's on and still in school, or other siblings in the household who are still in school after that age. For children, when we're looking at our definition of a disabling condition, if under 18, we're looking at a physical or mental impairment or combination of impairments that results in marked or severe limitation in functioning. So the medical examiners are looking at the ability of the child to function relative to other children their age. A child must either be blind or disabled. If the child is blind, they do the same definition as an adult. And for all of our disability programs, a condition must be expected to last at least 12 months or result in death. That definition is the same for Social Security disability, SSI, under 18, over 18. That part of the definition remains the same. It needs to be like a long-term condition. So that's how we define disability as for a child, but as soon as a child turns 18, we're then looking at the medical definition for an adult. And that's somebody who has a person who has a severe medical condition, again, expected to last at least a year or result in death. Like we talked about, that's the same all the way through. But once they become an adult, once 18, we look at a person's ability to perform substantial gainful employment. So the definition of disability changes in that way as soon as somebody turns 18, looking at whether they can do that substantial gainful employment, whether they can do something they did in the past, or whether they can do future work and make that amount. So that substantial gainful employment, substantial gainful activity is always a dollar figure. And anytime we have a cost of living, there's going to be an increase. So if we have a cost of living increase, these figures will go up. So everything that Jack and I talk about today is, since this is being recorded, we want to be clear, this is effective with March 12th of 2024, that these figures are accurate. If we have cost of living increases or anything changes like that, the most up-to-date information can also always be found at ssa.gov. But as of right now, our definition of substantial gainful activity is preventing someone to be able to work $1,550 gross a month for that long time period, so for at least 12 months. And for an individual who meets our specific rules of blindness, that amount is higher. That's $2,590 a month. Now, we use this definition for SSI and Social Security disability both during the initial claim when we're making that first medical decision. And then Social Security disability continues to use it once someone is on benefits as well. So to get SSI, we're looking, like I said, at income and resources. We always also look at where someone lives. So we do not pay SSI to individuals who are living outside the United States or Northern Mariana Islands. You usually need to be a citizen. We do have provisions for non-citizens, so it's not necessarily making someone ineligible, but non-citizens have very specific qualifications they need to meet. And we do not pay for the other territories like Puerto Rico, places like that. You must be in the continental United States or Alaska and Hawaii. So with income, whenever I'm talking about these next couple slides, income, and then we're going to talk about resources, one thing I like to mention is these are just the most common types of income we might see. So we're going to go through an entire list of tons of different types of income when we do the application. And then we're going to say, is there any other income or support we haven't mentioned? Because there could be something that we haven't covered in that scope of the application questions yet. And so we need everything told to us during the course of this application. Now we're looking at the income, not only of, if it's a child applying, not only that child's income, we're also looking at parents' income. And we're going to even ask about the other children, if they're siblings in the household, minor child siblings are still in school siblings in the household's income. That doesn't directly affect a child on SSI, but it affects how much a parent can make and the child still qualify if their other children in the household have income. So the reason that this income is kind of broken into two categories is we count earned income differently than we count unearned income. So types of earned income would be gross wages, net earnings from self-employment, payments from a sheltered workshop. Some common types of unearned income are Social Security. Sometimes people's Social Security is lower, so they receive from both programs, or veterans benefits, unemployment benefits, interest, pension, or even cash given to the individual that's filing from family or friends. And like I said, if there's anything else we haven't mentioned in the course, but that person has that income, we'll ask that to be given to us at that time as well. Now for resources, again, these are just some of the things we're going to ask. Is there anything else in your name when we get to the bottom of our list of questions? For resources, there are a lot of policy and provisions with SSI. So if you're in doubt whether someone might qualify, it's always best to contact Social Security directly so we can go through and see what a person has and make sure if there's any exclusions we can apply to things. But the most common main types of excluded resources are the home in which someone lives in. So it doesn't even matter if it's a mansion. We always exclude a home that the person is living in. And then a vehicle, we exclude the highest valued vehicle as long as it can be used for transportation. So if someone has an antique show car, but they only take to car shows a few times a year, they don't drive it, we can't exclude that because that's not used for transportation. But otherwise, it does not matter if they're driving a Rolls Royce, as long as they drive it to doctor's appointments, the grocery store, things like that, it's being used for transportation, we can exclude that. Now, any additional vehicles, though, do count as a resource. Now, commonly, we'll run into the cases where there is a second vehicle, but maybe there's a loan on against that vehicle. We all know we leave the car lot and all of a sudden we owe more than our vehicle is worth. So we only count the equity in the vehicle. If there's a loan against it, the loan is more than the vehicle, that's not going to be countable until that loan is paid down. And, for any other additional vehicles. We also exclude burial plots for the individual and their family, and we have certain policies for money set aside for burial where we can exclude certain things. But we do look at any bank accounts, IRAs, CDs, stocks, bonds, 401ks. Now with 401ks, I do like to mention, let's say it's a parent's 401k of a minor child that's filing, we do not count their 401k. But if an individual themselves is filing, we're going to count the value of the 401k that they could get at that time, even if they're taking a penalty to take it out. We also look at, like I said, the vehicles, life insurance, we're only looking at that if it has a value to it. So a cash surrender value, or it pays off dividends, things like that. If it's only payable when someone passes away, then we're not counting that policy against the person. And then property other than where someone lives. So the house and any lots attached to the house are excluded. But if someone has an additional property, including property in foreign countries, that's going to be countable. So an individual, including a child, has a $2,000 resource limit. Now, a parent also has a resource limit. If there's two parents in a household, they have $3,000 resource limit, and the child also has a $2,000 resource limit. And the way this actually works is if there's two parents in the household and theirs go over 3, but the child doesn't have anything in their name, they get to go use that child's $2,000 as well. So basically, if it's two parents and, a child filing in the household, then the total resource limit is $5,000. One thing that affects SSI that doesn't make somebody completely ineligible for SSI, but will determine payment amount, are living arrangements. And we do get a lot of questions around living arrangements, especially once a child turns 18 or older. But with living arrangements, we are looking at if someone's just living with its parent and minor children in the household, we're not going to ask a bunch of questions about the living arrangements other than, do you rent? Do you pay your own bills, or is somebody paying them for you? But if someone's living in another household, someone else's household, then we have to get into developing living arrangements, how the bills are paid, who's paying how much of what. In an institution, if it's a Medicaid institution where Medicaid's paying more than 50%, then we generally are going to be paying $30 a month. And if someone's in a group care or board and care facility, each office will have precedents for those where we have to review it to determine how the payment works at that particular facility. So for children, we are looking at their own income and resources, like I said, as well as parents in the household. So some common types of income for children might be child support, Social Security, or like we talked about, gifts from family and friends. Now, generally, we count unearned income, like Social Security, dollar for dollar, and we have a $20 earned income exclusion. Child support, though, is counted a little bit differently. We look at 2/3 of the child support. And if it's for multiple children, we're only going to be counting, let's say there are 3 children that one child support payment is for. We're going to divide it by 1/3. So we're counting 1/3 for the individual on SSI, as their total, and 2/3 of that is what's going to count against their check. Deeming is the term we use in counting parents' income and resources. When a child is under 18, we are looking at the income and resources of the parent in the household. And as soon as they turn 18, we stop looking at that, but we're looking at natural, adoptive, step parents in the household income and resources. And we look at these even if a child is living away for school, but coming home on weekends, holidays, school vacations, we're still considering them to be living with their parent at that time. One resource I'd like to mention, and I will say we do have some information in Spanish, and we have a Spanish website, but unfortunately the Spotlight page is not available in Spanish. But this SSI Spotlights is a section where you can go to get a lot more information on many of the topics that can confuse people with the SSI program. So one of the things that's covered is living arrangements. Another thing that's covered is SSI benefits for non-citizens. So if you have somebody that's not a citizen and you're interested in learning more on what categories qualify, you can find out more information there. A lot of different great topics. Also, living arrangements get in more in depth than we're getting in this presentation, and deeming, student earned income exclusion, all good topics to review and get in more detail with the SSI program. Now, we've kind of been focusing on a child under 18 for the most part so far. As soon as a child turns 18, 2 things are going to happen. If they're already receiving a benefit, we're going to do a new medical decision, and we're going to do a review of the non-medical factors. So we're going to do a redetermination and no longer look at the income and resources of the parents. However, we will then look at how much of the child's SSI payment is going toward food and shelter in the household now that they are 18. So we're going to review the living arrangements. Say you have a child who was unable to qualify for SSI because their parents' income and resources made them ineligible, then that application can be made as early as the day the child turns 18 to determine if they now meet the criteria with just their own income and resources and their medical information. So in those situations, someone needs to wait till the 18th birthday before we stop looking at the income that's making them ineligible, the parents' income, the parents' resources. But an exception to that is our youth in foster care. So if there is a disabled youth transitioning out of foster care and 18 or older, and they're transitioning out, they can actually apply within 180 days of losing their foster care assistance. So if that foster care assistance is making them ineligible for SSI right now, they can start the application process early, and with the hopes that we're going to get them on the way to having a medical decision before they completely lose that income that they're receiving from the foster care to try to help that transition process. So that's for, of course, foster care who have the blindness or a disability. They can start that application process early. Now, for adults, as soon as someone's 18, there are parts of the application that can be done online. Sometimes individuals can do the entire SSI application online. If they can't, they can still get the process started online. So if you're applying for a benefit anytime over the age of 18, you can start it as a Social Security disability application, even if not going to end up eligible for Social Security disability due to lack of earnings. That will take you to a question that asks if you want to file for SSI. You would answer yes. Once you get through that, sometimes that SSI application will come in the path online. Sometimes the office will recontact you to go through that SSI application. And then it also, though, importantly, will take you on to the adult disability report, which is super helpful to have done in advance. Now, when applying for a child under 18, the SSI application is never available online, the part that talks about income and resources. However, you can get the child disability report done online, which again is very helpful. In my experience, I often find that when people are filling out the adult or the child disability report online, they seem to put in more information than they might give us when we're on the phone with them. So they're more willing to spend some time describing conditions a little more and the limitations of those conditions when they're kind of sitting and able to think out what they're writing at home. So that is a nice thing I've just observed about the people filling out those online disability reports. Now, with the child disability report, we're also going to need an appointment scheduled to go through that income and resources portion. So you can call our toll-free number, 1-800-772-1213 from 8 a.m. to 7 p.m. There are interpreters available in many different languages. There'll be a prompt to choose Spanish if that's the language that you need when calling our 800 number service. So once we've gone through the SSI application, we've gone through the income and resources, and we've determined, is the person eligible based on the non-medical factors? So they're under the income and resource limits. If we've determined they are, we're then going to forward the application to our disability determination service. That is where the medical decision is made. Now, the majority of our claims will go to Springfield in Illinois, but we're also having some of our claims offloaded to other locations like Dallas, Texas. So don't be alarmed if you have a claim pending and you hear from somebody in another state. They're just helping some states who have less claims pending are helping other states who have longer wait times. So that can happen. But whoever ends up with that claim, the DDS will contact medical providers to obtain medical records, which you've listed in that report or gone through in the interview with someone from the office. And they oftentimes send out additional forms asking about daily activities. They might send out forms to parents or other people listed on the record about what they observe of a condition as well. Generally, our medical decisions are taking at least 6 to 8 months, and we cannot pay until we have a final decision. However, there is an exception to this. This process does not necessarily mean the decision will be made more quickly, but it's something that allows us to make payments to people who are likely to be awarded based on their conditions. So this is called presumptive disability, and you can find the presumptive disability conditions right on SSA.gov. This is one of the reasons why it's good to be specific in describing conditions as much as possible, because the computer will pick up on if this is a presumptive disability, and it will let the office know, hey, we might be able to pay this person right away. So that's why we want this, like the actual condition written out so that our computer software will pick up on that. And it's helpful to the examiners too, of course. So with presumptive disability, if it's selected as one of these cases, We can do payments for up to 6 months while waiting on the disability decision. If someone's awarded, we'll do the update to just continue those payments. But if they're denied, we do not require they repay the presumptive disability payments that have been sent to them. Once all the medical review has been done, they've reviewed medical information, the records, they ask for someone who's applying, a child or an adult, to go to a consultative exam, which is when they are examined by a doctor contracted by Social Security. And those appointments are really important to keep because you can be denied for missing them. But they're going to gather all the information at the Disability Determination Service, and then they're going to make a decision. With SSI, we almost always need to talk to the person again before we can begin payment. Social Security disability will oftentimes just start right up, but SSI, we need to usually do an update of the income and resources and the living arrangements if it's for a child or a younger adult who doesn't have ability to manage funds. We're going to go through a representative payee application. So there's other things we need to do. So if approved with SSI, we're usually going to have that conversation first, go through that update, and then the letter would come out after the SSI claim specialist has gone through that review, showing how much the benefit will be. If denied, then the Disability Determination Service sends the letter explaining why it was medically denied and how to appeal if you don't agree. It's really important to appeal these decisions if you disagree with the medical decision. For SSI, we do not pay back past the point that someone contacted us. So even if someone has had a disability for 5 years, we can't go back and pay them for that. If someone would contact us today, either by starting the application online or by contacting us and setting up an appointment, then March 12th is what we call the protective filing date. If someone meets all the income and resource requirements with March, and they're then later medically approved, we can start with March being the eligibility month. April of 2024 would be the first month payable any payment. So if someone takes 6 to 8 months to get their decision and they're denied, and then they file the appeal within 60 days, you can file either online or by requesting paperwork from the local office, and it takes another 6 months, but they are awarded, they're going to have a year plus of back pay going back to eligibility month of March, April 2024. But if an individual does not file an appeal, and then, another year down the road or 8 months or however long, conditions are still there and they file all over again, they're going to start all the clock all over again new with a new protective filing date for payment purposes. So that appeal is very important. Under SSI, what I really like to say is we pretty much have to know everything about your life. So you are going to have these slides available to you. I encourage you to review them because there is a lot of information we're covering today. But in general, all changes need to be reported as soon as possible and ideally no later than 10 days after the beginning or end of the month in which they occurred. I'm not going to read through all of these, but these are all the sorts of things that need to be reported to us when on SSI. So it is a very, in-depth program of what you need to let us know about. If anyone's moving in or out of the household and all the income changes, all the asset changes, always need to be reported to us as soon as possible. And like I said, you're going to have these, you're going to have the copy of the slide you can access, but we also print these up whenever we print out the update of the application, if someone's awarded, so that they have them all in front of them and they can keep that paper to be reminded of what they need to report. Now I'm going to turn things over to Jack to talk about Medicare and Medicaid.
Thanks, Megan. Now, before I get started here, and I know there are some things in the chat that I haven't really been monitoring the chat as much as the Q&A, so I assume we'll touch base on the chat at the end. But in the Q&A, there was one that popped up here, and I started to type a response, and I thought it might be best to just run it by you.
Okay.
It's a specific condition. And so what I'll say first is, I'm going to read the question, and I'll give a short answer, and then have you weigh in. It says, I've read the slides in Spanish and wanted to know if my daughter's diagnosis qualifies for this program. She has a diagnosis of, and I apologize if I don't pronounce this correctly, microtia grade 3 and atresia. It is a hearing condition. That's the question. So my thoughts on that are that, we're not experts on all of the medical conditions. So, we don't really know if that's a condition that would qualify her for approval for SSI or not. Our guidance, or my guidance anyway, that I usually provide is, if you feel that it's a severe enough condition that it limits your daughter in the ways that Megan discussed, then she should apply, or you should apply on her behalf, and we'll get a formal medical determination. But I really kind of wanted to touch base with you, Megan, just to see if you'd heard of that condition, if you knew if it was on presumptives or anything like that.
I've not, and I do not have the presumptive list memorized at this point. When I was a claims specialist, which has now been 7 years, I did know most of them off the top of my head much better, but it's been a long time, and they're constantly adding conditions to those lists. So the best thing to do, I can check when we get to the end to see if that page is available in Spanish on our Spanish website. But otherwise, I stand with you too, Jack. Like, we're not going to be sure. And it's always good if that is a question to try filing and let that medical decision be made. Then if it is one that is a presumptive disability, if we've missed it in our interview, that's going to be selected as soon as it's transferred to the disability termination service, and then we'll be notified that it meets that criteria.
Thank you, Megan. And I do note that the question didn't really ask about presumptive disability. I threw that in there myself.
Yeah.
But just, just so that point is clear, it wouldn't be something that we would want to tell you, oh, no, don't apply, or do apply, because, we'd hate to have you miss out on benefits, because we're not the medical experts. Even in our field offices, we don't make the medical determinations. As Megan mentioned, those are made by the Disability Determination Service. So we'd want to make sure that you get that application filed if you believe that the condition causes those limitations. So getting into a few more topics here, and hoping to leave some time to finish up the Q&A at the end of the session here, I want to touch base on a couple types of insurance, because I know there are it's often confusing, right? Whether or not a person who's on SSI versus Social Security is going to qualify for Medicare, or if they're going to qualify for Medicaid. So, Medicare is something that is typically going to be for people who have worked and paid into Social Security. Maybe they're getting it on the basis of age at 65 or older, or maybe they're getting it because they're on Social Security disability and they've been on disability for 24 months through the Social Security or SSDI program. Now, that could be on their own earnings record, or it could be on the record of a deceased parent or a disabled or retired parent if they were disabled as a child under the age of 22. So there is a possibility that Medicare could be for a disabled adult child, but a lot of times that's more associated with, the worker and retirement, where SSI folks typically find insurance is through the Medicaid program. That's going to be a state health program for people with low income and limited resources. And in most states, children who get SSI qualify for Medicaid. In a lot of states, Medicaid will come automatically with SSI eligibility. So if you're new to Illinois, maybe you lived in a different state at a different time, you may not have had to apply, or maybe you knew people who didn't have to apply for the Medicaid. But in Illinois, you do have to apply for the Medicaid. It does not come automatically with the SSI entitlement. Next slide, please. Another thing I want to talk a little bit about is what we call the representative payee program. The representative payee program is for people who need assistance managing their funds, whether those funds are paid from the Social Security benefit program or the Supplemental Security SSI programs. Maybe it's because they're a minor child. Maybe it's because they're a disabled adult. For whatever reason, they can't manage their own affairs. They need help managing their own affairs. And so we need to appoint somebody as representative payee. Now, typically that's going to be a family member or some interested party who is in position to help that individual address their needs, help them meet their basic needs with the funds that Social Security pays. And there's a process that goes into it, right? We have to have you file an application to be payee. We've got to review the application. We've got to review your qualification to be payee, as well as the individual's need to have a payee, because it is something that we have to take very seriously. We're taking that person's benefit or their money and we're putting it into another person's control. So, for that reason, we have to have that application and make that determination. Now, once you become payee, if you are an individual representative payee, there are things that you can do through your own personal My Social Security account. So if you create an account for yourself, you can go into or log into that account and you'll have the option to look at your own information or to access what we call the representative payee portal, where you can do things for the person that you serve as payee for. And some of those options include things like managing direct deposit, if it's not SSI, if it's regular Social Security, wage reporting, different things like that, getting a benefit verification, something that shows how much they receive, which is often important when you're getting a needs-based benefit such as SSI, because a lot of times you need to show other programs how much you get. So, those things could all be obtained through your own personal My Social Security account if you are an individual payee serving for somebody else. Next slide, please. Megan talked a little bit earlier about a general income exclusion, but we also have what we call earned income exclusion. So, if you're receiving SSI and you're doing a little bit of work and you're wondering, or your child is doing a little bit of work and you're wondering what impact that work will have on their SSI eligibility, we can exclude the first $65 of earned income that they receive. And then after that, 1/2. So in other words, if they received $85, or if they earned $85, we could exclude the first 65. And then of the next 20, we would exclude half of it. So basically $85, we would only count $10 of it because we'd exclude the first 65. And then of the next 20, we'd only count half. So generally, that's how it would work. It would offset the SSI benefit by half of the amount of earned income in excess of the $65. Now, there's also a possibility if they don't have any other income that we would tack on that other $20 general income exclusion, because we can exclude the first $20 of any kind of income. So if they haven't used that to exclude other income, then we'll apply that here too. So it's possible that we could be excluding the first 85 of unearned and then 1/2 of anything above it, but that's going to depend on whether or not they have any other type of income. Next slide, please. Now, the ABLE account, Achieving a Better Life Experience, this is something that has been around for a few years now. In order to qualify for an ABLE account, right now anyway, an individual has to have had a disability since the age of 26 or before the age of 26. In a couple years, that's going to change, and that eligibility age is going to go all the way up to 46. So I think it's 2026 when that's coming. Basically, at that point, you'll be eligible to start an ABLE account if you've had a disability since prior to age 46. But for now, it's still 26. But if you have a disability before the age of 26, you can open an ABLE account. Contributions to the account can be from anyone up to $18,000 a year. And the great news about it is it doesn't affect eligibility for a lot of needs-based programs, SSI included. So, we talked a little bit, or Megan talked about the resource limits that are involved. Well, if you have money in an ABLE account, up to $100,000 is excluded as a resource for SSI. So you could have far far more than the $2,000 allowable resource limit as long as you have that money in an ABLE account. Next slide, please. Just a couple more points on ABLE accounts. They have to be used for qualified disability expenses. So the funds that are in an ABLE account have to be used for qualified disability expenses. But that's a fairly generous term. There are a lot of things that fall under that category, including the things you see on the slide here: housing, education. I've even seen, things like groceries, things like that are kind of lumped into that category. So a lot of the day-to-day living expenses that a person has can be covered with those ABLE accounts. And a lot of states, I'll say most states, have their own ABLE accounts. These days, you don't have to use an ABLE account in the state that you live in, but I think it's always a good idea to check your own state ABLE system or ABLE accounts first to see if that makes sense, and then if not, take a look at other states. Next slide, please. So whenever a person returns to work, there are a lot of responsibilities. You've got to keep in touch with them. Communication is key if you're working and receiving Social Security or SSI disability benefits. You want to let us know things like if you start or stop work, if there's a change in your duties or your hours or your pay, if there are expenses that you pay due to your disability that allow you to be able to work, you want to report those things to us. And there are different ways you can do it. You can mail things into us, you can fax things to us, you can call us, you can call our national toll-free number. You're probably going to be better off calling your local office for wage reports and things like that. But if you can't get through to them, you could also always try that national office. I think this says 7, but I believe it's 8 a.m. to 7 p.m. is the national toll-free number right now. But again, you probably want to go to ssa.gov/locator and look at your local office's contact info and try to reach them first if possible. Next slide, please. So again, just a few ways you can report wages if you're getting Social Security or SSI. The personal My Social Security account, calling the office, mailing or faxing, calling that 800 number that we talked about before. For SSI recipients, we've got another option. It's actually 2 more options. There's a mobile wage reporting application and then also a telephone wage reporting service. But for those things to work, it starts by contacting the local office and making that initial work report so we can get all of these things set up for you. So still, that initial communication with your local office is going to be key in making sure that we know about the work and we get it set up into our system so that we can, kind of help you figure out the most convenient way for you to report that on a monthly basis. And if you can, it's always helpful when you make that initial call to have the employer's identification number, the EIN. That's something that shows up on a W-2. Typically, employers don't tell you about that or don't talk about that when you're starting out a job, sorry. But it's worth asking. It'll just make it a little bit easier for you when you go to report that to us. Next slide, please. So these are just some resources for you. So if you want to learn more about working while disabled and what your options are, what we call work incentives, learn about those things on our website, ssa.gov. In the publications section, you can find this great publication called Working While Disabled, How We Can Help. It's got a lot of info on the work incentives, what happens when you're working and receiving benefits from disability or SSI disability. And then there's also the Ticket to Work program. So the Ticket to Work is a good program for people who want to get back into the workforce or maybe get into the workforce initially if we're talking about kids who are transitioning into adulthood but dealing with some sort of disability. There are employment networks that you can maybe get connected with through the Ticket to Work program, maybe learn how to get connected to employers who are a little bit more supportive of people who are working with disabilities. So those are some things worth checking out. Again, that's Ticket to Work and the Working While Disabled. And you can see the ssa.gov/work. That's going to take you to the Ticket to Work site within our website. Next slide, please. Now, when we talk about SSI benefits, as Megan has given us a lot of good information on tonight, that's one thing for you to be aware of. Now, that's going to be the needs-based program. That's going to be what a disabled child would typically qualify for, because they haven't had an opportunity to work and earn credits towards Social Security disability. But there's always a possibility of what we call auxiliary benefits for children. And auxiliary benefits are payable to children who meet certain criteria. And part of that starts with the parent and what the parent has done. You know, did the parent work and pay into Social Security? Did that parent now start collecting retirement benefits of their own? Or perhaps they're collecting disability benefits, or maybe they passed away. So those types of things, either retirement, disability, or death of a parent who worked and paid into Social Security, are the types of things that trigger eligibility for auxiliary children's benefits. Now, these auxiliary children's benefits can be paid to children who are unmarried, who are under the age of 18, or between the ages of 18 and 19, and still full-time high school students. So in those situations, we're not talking about any need to prove a disability. It's just because they're minor children and they have a parent who hit one of those criteria, either retired, started getting and started collecting retirement from Social Security, started collecting disability from Social Security, or passed away after working and paying in enough to entitle survivors. So that's one possibility. But then there's also the possibility of what we call a disabled adult child benefit. So let's say you have a minor child who was getting benefits, maybe your spouse passed away. And so your minor child has been getting benefits as a minor on your deceased spouse's record, but your child also has a disability. If they're approaching age 18 or 19 and they're about to be cut off from that minor child's benefit, you might be able to qualify them for a disabled adult child benefit by applying for disability on the deceased spouse record. And in order to qualify for that disabled adult child benefit, the child has to be found disabled prior to the age of 22. So that's a way to get them on to Social Security disability insurance instead of SSI. Now, it could also happen where your child is an adult and then they're on SSI, then you sign up for retirement and they become eligible for a little bit more because they've been eligible because they've been disabled prior to the age of 22. So, you know, that can change through the years. And so when you apply for your own retirement, there's a question that we ask: do you have any disabled children or any disabled adult children who were disabled before age 22? Next slide, please. This is what our website looks like. So this is just generally for you to see what the SSA.gov homepage looks like. Next slide, please. The field office locator I mentioned earlier, ssa.gov/locator. Put your zip code in there and it'll pull up your local Social Security office contact info. I mentioned the My Social Security account earlier. So when you go to log in to My Social Security, this is kind of what you're going to see. On the left there, you're going to click Create an Account or Sign In. And then honestly, whichever one of those buttons you click, you're still going to get what you see on the right, the Create an Account or Sign In. So basically, you've got three options there. The bottom one that says sign in with Social Security username, that's the one you're going to use if you had created your account before September 18th of 2021. Then you'll be prompted for your username and your password. If you created your account after that, you're probably going to want to click on the sign in with login.gov. You could have used id.me, but the default's been login.gov. So unless you know specifically that you chose id.me, you probably want to start with login.gov and try to get signed in that way. Next slide, please. This is just kind of an overview, kind of instructions of what I was just talking about on how to get signed up and how to get logged into your account. So we'll go ahead and move on to the next slide, please. You can review this when you're looking at the slide later. This is an important one because, I talked earlier about the representative payee portal, where if you're a payee, you can log in and do things for the person you serve as payee for. And it's key to note that that's the proper way to do it. You should not be creating an account for somebody else, because You can't create a My Social Security account on behalf of another person. And that's true even if you're their payee. You're not supposed to create an account for them. Now, there are certain circumstances where you can assist someone in creating their own account. And those are very specific. If they're sitting right there with you at the computer, if they have their own email address, if they can answer questions about themselves, if they understand what you're doing and they just want you to help them, that's fine. But if they're not capable of comprehending the process of creating the account, then you shouldn't be creating one for them. So just kind of try to use those two things as, or that, I guess, mainly one thing as the deciding factor of whether or not you should create an account for somebody. But remember, if you are their payee, you'll be able to get most of the information you would want through your own My Social Security account anyway, because of your relationship as payee. Next slide, please. And with the My Social Security account, these next couple slides just talk about some of the benefits of having an account. I'm going to go through very quickly just a couple ones, and then we're going to get to the Q&A here. But basically, if you are receiving benefits, you can do things like request a replacement Social Security card. And actually, you don't even need to be receiving benefits to do that. But one of the things that is great if you're receiving benefits is you can report wages. You can get those benefit verification letters. So those are going to be some of the big ones for people who get SSI. Some of these things are limited. If you get SSI, you can't do name or address changes, direct deposit, because of the needs-based aspect. We've got to ask you some more questions. But the benefit verification is a big one, and the ability to report work for somebody who's on benefits and is attempting to work, those are real time savers for you. Next slide, please. This next slide just kind of talks about some of the things you can do before you're collecting benefits. And this is where this is what I wanted to talk about before when I said you can request a replacement card. One of the most common reasons people visit us at Social Security is to request a replacement card. If you need a replacement Social Security card and you have an Illinois driver's license or state ID, or actually one from most states, if you don't need to change any information, you can do your application from start to finish right on the website through your My Social Security account, and that card will be mailed to you. Even if you do need to make some changes, you can typically at least start that application and make that process a lot more efficient. So it's a good way to do that if you're looking to do anything to do with a Social Security card. At least check out the website to get started there. Next slide, please. Okay, and with that, we're going to go ahead and see if there's anything in the chat. I know we're running up against our time here, but is there anything in the chat that's unanswered or questions that we need to get to in the Q&A?
Oh, yeah. Going as fast as I can, but
I'll stop and say if we don't get to everything, we have the ability to download the Q&A, and we may be able to provide some of the responses.
yeah, and I can stay on a few minutes after to get through
Sure.
some too, if need be, if people want to hang in with us. If that's okay with you on your end. I do want to answer one out live, because it's a common question, and I think there's a couple variations of it in the chat even. Can you explain fair share and what's decided to get a reduction in SSI benefits for a disabled adult? And I actually had these slides in and I took them out because we were mostly focusing on children, but I should know better. So, okay, for fair share, and we have some information in the spotlights about living arrangements and things. Let's say that there are 5 people in the household. It does not matter the age of those people. It can be an infant on to a 90-year-old, and your turned 18-year-old child is one of those 5 people. We look at a fifth of household expenses, and we cannot tell you what to charge for fair share. So we're going to ask how much is, if the child already has SSI, how much of their check is going toward household expenses, and I'll cover what those are in a moment. And if they're not on SSI yet, generally they're going to start in a living arrangement where they are considered to be what we call a B living arrangement. They're not paying toward income and resources, but as soon as the check starts, if they start paying toward income expense, toward living arrangement expenses, then we're going to do a change to show that they do that, and it can possibly raise them to the full rate. But say it's a redetermination, the child's already on SSI, they have a SSI check. We're going to say how much of that money goes to expenses. There's 5 people in the household. We're going to look at rent or mortgage. If there's a mortgage, we're going to look at property insurance and property taxes. We're going to average these out monthly. So you pay property taxes twice a year. We're going to times that by 2, divide it by 12. Then we're going to look at however you heat your house, whether it's gas, heating, fuel, whatever, the average monthly bill, and the power bill, water, sewer, and food. So if a child's paying the cable bill and the internet bill and the phone bill, those don't go toward anything. So we're asking how much of their check goes toward those expenses, and they'll walk you through them. Or if they buy their food separately, completely separately, then we're going to ask about that. And for food, we're going to ask how much is the food bill after any SNAP assistance for the household. So it's everyone's bills. And then they need to be paying 1/5 of all of those monthly bills with their, with their existing income to go up to the full amount if they have no other income. So if the fair share of bills is $1,000 a month, they can't pay their fair share. It might still help them toward their check to say they're paying whatever. And of course, it's going to help the household. If they're over 18, they certainly can be paying toward household bills. But they have to be able to pay their fair share with the SSI check to get the full check. And if you say they're using every dollar of the SSI check, that might not be exactly accurate too, because they probably need to pay for some other things in life. But again, if the household expenses exceed that, so if that scenario, those expenses are $5,000 a month, they can't meet their fair share. We can't pay them the full amount because they're not meeting their fair share. So that's how that works. SSDI, Social Security disability, we do not care about the living arrangements. We don't ask about them. We don't care how much money is for the household bills. We do not care how much money is in the bank. We don't care about anything but wages or if someone's receiving workman's comp, but mostly if they're working. Again, a lot of questions about when to apply for a child if they're coming up on 18. Just remember the key thing, unless they're part of that foster care exemption, is we are going to count parents' income and resources, an adoptive parent, a step parent, a biological parent, any of those categories. We're going to count your income and resources until they turn 18. So the day of the 18th birthday is the date that we no longer look at those. So if you're going to be applying for SSI and you apply the month before they turn 18, you can get denied based on income and resources alone, even though you're so close to 18, because they're not 18 yet. So that's the big time to look at when you're going to be doing that program. We did get some questions about Medicaid, and for the most part, we're going to refer you to anything too specific directly to the Department of Human Services for questions on Medicaid eligibility, because we only do the Medicare.
I'll jump in if I can real quick here, because I saw one of them was specific to an ABLE account. Yeah. So I was just doing some research here. If you look at IllinoisAble.com, which is one state, our state's ABLE program, they have an FAQ section, and there they state that it says you will not lose or lose eligibility for federal benefits, including SSI, SSDI, Medicaid, and HUD. So according to IllinoisAble.com, you would not lose eligibility for Medicaid because of that. So just FYI there. And I'm going to put in that question, I'm just going to put IllinoisAble.com as an answer for further research if you wish.
Child coming up on 18 to apply for SSI or SSDI. So SSI is the needs-based program. SSDI is based on an earnings record. However, what I was talking about in the earlier part is when they're 18, the SSDI application is your gateway to doing it online. And we're always going to screen for the programs no matter what. If the office ends up with it, as long as someone told us they want to apply for SSI, And if they have any earnings, we're gonna run to see if they qualify with enough earnings for SSDI. So we're gonna look at that, but if you're wanting to do it online, you need to start with the SSDI and wait till they're 18. Okay, so again, with the 18th birthday, wait until the 18th birthday. I know it'd be nice to be able to start it early, but there's just that issue of protective filing before the 18th birthday means we're counting income, parents' income and resources. There's a question about a former foster child and assuming if monies were drawn out of their Social Security, that would have been the SSI program. It's not their Social Security. It's the needs-based program. It comes from the general fund. There's probably not going to be a lot of information given about anything prior that the child went through before becoming, if you've adopted or if they're living with you or if you're a guardian. Generally, there might not be much information provided. I did text someone about the Spanish presumptive disability. I don't know that I haven't heard back yet, but we can try to get that answer when I have time to research on the website for you guys and email. Court-ordered child support going to a payback special needs trust treated. That I don't know off the top of my head. That would probably be a policy research. One thing I'll say about parents' income while we're kind of on this topic, if a parent is working and they're parent of a child under 18, you're working and you have child support garnished from your paycheck, we will reduce that from the gross income before we count it. How it affects going into a trust, that's not something I'm able to answer right now. That's probably something we'd have to dig into policy for.
I think we'll probably take maybe if there's maybe one more question in the chat, and then I'll kind of wrap up. If there's anything that we didn't get answered, I can send it over to you guys and we can try to do it via email.
So I think some of the chat went over to the Q&A because I answered some of these in the Q&A too. So.
And then were there, I think if we click the answer live, if there were any, because I see a lot of age-based, like when do I apply? So maybe if you hit that answer live, it'll clear off those questions.
Okay. I wanted to, thank you both for being here, especially in presenting all this great information. You definitely do it much better than I could. So thank you so much for being here. I know it's very big topic that everyone was very interested in, so we really appreciate it. And we thank everyone that was, participating today, that took their time out of what I said at the beginning, a very nice day to come and learn about Social Security benefits when you could be outside in nice weather. You will get an email after the webinar from Zoom, and all the materials and the recording will be posted on our website. In the email that you get, that link will be there, so you'll be able to go to that link and get the materials too. And when you click out of Zoom, a survey will pop up at the end. So we just appreciate any time that you can give to complete that survey and putting any comments in there about other topics that you would want more training on. We take that feedback and create trainings for the next year based on that feedback. So last year, a lot of people said that they wanted a training on Social Security. So we, brought in some speakers for that. So please feel free to make any suggestions that you have. And then these are the future trainings that we've got going on for April and May. We've got the Medicaid denials, and then May we have transitioning health insurance benefits to adulthood, and you can register for those on our website as well. And then if you have any questions that you want to send to us after the webinar, you can use the general DSCC email or call. If you're linked up with DSCC and you have a care coordinator, you can also bring questions about Social Security or other benefits to your care coordinator, and they can get linked back up with my team to get some answers to those. But if you're not with DSCC or you want to just send in a general question too, you can use this dscc@uic.edu email, and then it'll get routed to me, and we'll make sure if we need to involve Jack and Megan in the answer, we'll get with them. Any final questions that you all want to answer tonight live? We got most of them. I know there's quite a bit.
One question I started to type, it says, child is coming up to 18. Do we apply SSI or SSDI for her?
I think we kind of answered that too.
Okay. Yeah. So I would say, probably start with exploring SSI.
That was the one I was talking about. If you're going to do it online, to start with the SSDI application, and then to get do the other. Yeah.
Well, then we'll just end it here on a good note.
Yeah,
So
thank you.
thank you all. And I hope everyone has a great night and good rest of your week.